I am delighted to speak to you today on integrating palliative care in a prolonged humanitarian crisis in Uganda and Germany in particular. My name is Opia Vicky. I'm a palliative care nurse specialist based in a Germany district. The outlines for this discussion today is refugee population in Uganda and Germany, the needs of the refugees, both host population in Germany, integration of palliative care, and the impact and the key lessons learned while integrating these services in the Germany district, particularly in the humanitarian setting. The population of the refugee in Uganda and Germany that worldwide is known that Uganda is one of those countries that is hosting a lot of refugees, both from DRC, Congo, and South Sudan. We have over 1 million refugees in our country, and 80% of the population, 85% of the population are women and children. A small map of Germany. In Germany, we have over 250,000 refugees that we host in a Germany district. Somehow it outweighs the population of the nationals. What are the needs of the refugees during humanitarian agencies? Both of us need shelter. So one of the key things that the refugees needed was shelter, which was constructed for them. And you can see the kind of shelter that was constructed. They also needed food to survive. They needed food to live. So they were given food, and food was supplied by the humanitarian agencies. And something also key that was the need for the refugees was healthcare system. There's a picture of one of the community volunteers that went to visit them while in the settlement. What is life like for the refugees after the agencies or after the emergencies? Both the host and the refugees in Uganda and Germany in particular share the same health system, the education system, the sanitation system. You can see the kind of structure that they live in today as compared to the tents. Our own host, ourselves, we live in such a structure, and also the refugees have been constructed the same structure. The water and sanitation that we get, the borehole that has been constructed, have been shared together with the refugees. You can see the excitement of the little ones after receiving water, because water is life. Healthcare system, we go to the community and visit the persons with chronic illnesses, and all this, like the old woman is being surrounded by the grandchildren, and that brings happiness in their face. They also indulge into selling into the markets that we all join together. They have their own businesses. That is what life is with the refugees in Germany and Uganda as a whole. They have gone on even constructing houses. What is life like with those with chronic illnesses? Beautiful faces of both the host patient and then a refugee patient. But then this comes with challenges. We have this young lady, a mother to a young girl, was diagnosed with adenosarcoma, and yet she needed some finances that would take her for further support, maybe chemo and radiotherapy in Mulago. Mulago is a national referral hospital that is a distance away where we come from. But she lacked financial challenges. A meeting was organized so that the community would raise resources. But unfortunately, the husband was a man who was a drunkard. And in our culture, men are supposed to spearhead meetings. And therefore, the meeting did not take place and resources was not realized. She died before reaching the services. And this was a smile of a refugee, an ex-teacher who retired. She had liver cirrhosis. We found her while doing our usual routine hospital rounds. She had gross ascites. She had physical pain, psychological pain. We discussed a lot with her, and thereafter discharged her at home. While in the settlement, we visited her. We got a miracle happened. She wasn't what she was while she was in the hospital. The ascites reduced. She was full of smiles. I remember very well. She told us she feels she was 15 years and she's ready to get married again. To us, that was a miracle. I remember Dr. Moira visiting the same lady with us, and they shared a lot of social issues. And she promised to give scholastic materials one of the child who was with her. And that is what chronic illnesses is like with us in the community. I know we have a lot of challenges. And what is a gap? What is a palliative care gap? Well, we are supporting patients in the hospital, in a health center 3. We realized there were a lot of issues. And then we did some interviews with 108 patients. What did we realize? We realized there was a huge need, which was unmet. And we also realized that there was a high symptom burden. You realize that 67% reported severe pain that we use as score. Majority of them had 4 to 5 score of their pain. And only 7% had access to morphine to reduce the severe pain. That was how bad it was while we did this interview. Yeah. What are we doing to integrate palliative care into the system, into the humanitarian agencies? We're using a lot of approaches. We're not only using one approach to integrate palliative care into our system. We engage the community into community sensitization. Those the refugee council body in the local settings, and we discuss about palliative care. As though that was not enough, we also go on radio talk shows. We talk about the needs of palliative care, the needs of the chronically ill people. And we continue doing that every quarter, every month. We are using so many approaches such that we're able to integrate palliative care into humanitarian setting. And then how are we involving the leaders? We do a lot of meetings with policymakers, a lot of meetings with political leaders. And the person you see in yellow, Musk, is a political agency. He's one of the MPs in our district. We had a meeting with them, the LC5, the stakeholders in the district. And these are some of the says that they were able to put up after the meeting. And they're saying that as senior members of this community, we are not going to disappoint you. We'll take on and we'll make sure that this package or this project will never fail. And our presence there to them is like a God-given gift. A God-given gift, meaning that the people are going to receive the care that they are long awaited, that they have really been yearning for, and they feel when this system or when palliative care has been integrated into the system, their people's life will change. Yeah. We had a lot of trainings for the healthcare system, the healthcare within the hospital, the healthcare in the health center 3s, and we also trained what is called link nurses. As though this was not enough, I had a specialist practice. I was trained as a palliative care specialist with a bachelor degree in palliative care. I also did the nurse leadership course. And this helped us to be able to access medications and able to have a referral pathway, because the link nurses were trained, the health workers were trained. They're able to identify cases in the community and link into care. And one of the nurses had a commitment and said, initially I was doing things, but I was not trained. Therefore, he's able to assess pain, able to refer cases adequately now because he has the knowledge. That's what he's saying. I am a link nurse committed. By the time I did not get the training, I did not know what to do. But now I'm able to do. I'll do the really, really help for my people. That to me was a commitment. Yeah. Yes. We also had the training for the village health team. Village health team, these are members of the community that live within the community. They're being identified by the community members to be able to get the training that we offer to them. And the moment we train them, we realize they're able to link cases, identify cases within the community. Like one of them say that this is one of the most important and long awaited for training. I did not know this palliative care, but now have been transformed and I'll transform the community. That was a great commitment because as a person, he was transformed and now he's able to transform the community. Because some of the cases in the community, particularly chronic cases, are being seen as a taboo, and majority of them are left. And they're saying this palliative care training has acted to them as an eye-opener. And therefore, they'll do a lot of things to help their people who are in need. We did a research. We go on doing mentorship after the training, and the short courses has helped them as community volunteers and VHTs in their own community. Yeah. This is an amusing person. Philip is a refugee, and after having had a training, he says people are left abandoned. They lose hope, and his presence brings hope because he does a lot of spiritual counseling. He does a lot of cultural counseling, and he's saying after doing this, it has helped change the perspective of people's thoughts, and now hope is with them. I mean, even if they die when they're happy. And he has gone ahead mentoring, teaching his colleagues because of the knowledge that he has got. And to me, that is also powerful because what we do has a lot of impact on others. And that is Philip, a refugee in his settlement. And he's bringing a lot of changes. This is a community member. He is in the host community. When they completed the training, they go on identifying persons in the community. And he said he gained a lot of popularity as he's doing that. He stood for campaign, for election, and he won the election by 80%. And he's saying that is because of his gain of popularity in his community. People now know him, and he's bringing happiness on the faces of people. The community that he leads is no longer stressed. And he's saying, if only we get funds, we train others, not only the VHTs, but he's thinking of other leaders that lives in society. They need training. Then there's going to be a lot of changes in the community. He's one person who acts as a bridge between the hospital, between the community, and between the health system by identifying cases and linking appropriately. Yeah. Another key people that we trained for integration is the caregivers. Caregivers are not only those within the minute family members, but also persons in the neighborhood, in our society, act as caregivers. So we bring them aboard and we train them. And they say amusing things. Just as one of them said this, I've since been reflecting on how my mother, after being diagnosed with cancer of the cervix, has been crying, and together we join into the crying. She was reflecting on what is happening. And she further says, I came in a community where chronic illness is regarded as nothing. I take this to myself to apologize to my people, to apologize to my father in partition. And I will no longer value chronic illness, my people who have chronic illness, as a burden, but help them go through the challenges that they are in. That is a commitment that many people make after they undertake training, after they undertake short courses. They change and they do fabulous things. Yeah. Also, we offer holistic care to our community. The case in point is we offer passionate care in the hospital. We do home visit. We go to the homes of the people. We also go to the hospital and offer both physical, psychological, spiritual care, and we manage their pains as needed, or as needed. That is one of our community, our volunteers who go to the community and support our patients in the hospital, in the homes of our patients. Yeah. What is the impact of this integration? We have huge impact of the integration of what we did. One of the things is now, as we talk, palliative care is in the work plan of a Germany district, and also Health Center 4 and the district are providing palliative care. The staff in the Health Center 3 are able to manage simple cases and refer the complex cases to Peace Hospice and a Germany hospital. The VHTs are able to identify cases appropriately and link them into care. We have morphine available for pain management in a Germany hospital and the Health Center 4. And then the humanitarian implementers include palliative care into their system, particularly Medical Teams International. We have a focal person who sits in the cluster meetings, and also we have scaled up palliative care into other districts. We have key lessons learned here. Be ready for a long haul, and also we have involved wide range of stakeholders for integrating palliative care. We have ensured different approaches for palliative care to be integrated into the system. We have involved the community. We've not worked as an entity. Also, we inspire others to get involved. We offer compassionate, high quality, holistic palliative care. And then we're saying, do not give up, just go on and on and on. We acknowledge our partners, we acknowledge our donors for supporting us into integrating palliative care into the humanitarian system. I thank you so much.